After completing the medical history, the next step is to go into the restorative charting. In this example, we see that the restorative charting is going to have other information already present because it is already colored in. When I click on this and it opens up, the first thing that's visible is the tooth grid, but this is not where you want to go first. Immediately, you want to move to the questionnaire tab here. Click on the questionnaire tab, and this is where the pediatric Caries risk assessment is located. This is different than in the adult Caries risk assessment. The pediatric assessment is located at this spot, and this is the next thing to complete. Now, like the medical history, the first thing you should do is check here, and in this example, this has not been authorized. So get your faculty to come over, and the faculty member can come and authorize. Once it's authorized, then you'll be able to go in and copy this forward. This form, like the medical history, should be copied forward at every 6-month recall visit. So we will come over to the copy forward button, copy it forward into an editable form, and go through. The first part of this is Caries risk from the medical history. This is not a place to repeat all of the medical history, but only parts of it that you think could increase the patient's Caries risk. Most of the time, this will be a low risk factor. Salivary flow, make sure that you have looked at it and that it is normally adequate. It would be rare that a child would have inadequate flow. You'll go down and you'll look for Caries risk from fluoride. You'll continue down and look at Caries risk from diet. Now, this is a very important area that you want to make sure that you take a good history on, as you were taught last year. You'll come down after that and you'll do a Caries risk from hygiene. To this point, all of this has been done by interviewing the family. At hygiene efficacy, at this point, you will begin looking in the patient's mouth. They may have told you that they are brushing, 7 or 8 times. So maybe they tell you that they're brushing 2 times a day, and that they're brushing in the morning, and they're brushing before bed. Maybe they tell you that they're flossing 1 time a day. Maybe they tell you that the parents are supervising and that they're using a timer to make sure that they do 2 minutes. But then you look in the mouth and you say their plaque is moderate, it's located everywhere, and that they actually have slight calculus that is localized to the facial of lower anteriors. Give them a gingival index, and maybe they were actually bleeding from the gums, so that puts them up to a 2, and you felt like this was overall a high risk. So here's the first part that you're looking in the mouth to assess how good of a job are they actually doing with their brushing. At this point, you will stop. You will clean their teeth. You'll order radiographs. Once you've ordered radiographs, then you will come back and finish looking at their facial form, their occlusion, how they're breathing, and TMJ functions. And then we will go back to the dental information tab. Once I have clean teeth and I have good radiographs, then I will complete the charting.